Hi, today I'm going to talk about how cortisol can affect your thyroid function. My name is Dr. Lori Cayley. I am a certified functional medicine practitioner. I help women who have thyroid conditions to reverse their thyroid conditions naturally so that they can experience optimal health and get their lives back. Cortisol is released by the adrenal glands. The adrenal glands sit on top of the kidneys. When the HPA axis, the hypothalamic pituitary adrenal axis, signals the adrenal glands to release cortisol, they will do so. However, sometimes cortisol gets out of balance. Cortisol controls many things, including digestion and hunger, sleeping, waking, blood pressure, physical activity, stress levels, insulin release, glucose levels, blood sugar maintenance. It plays a part in your immune system and also in inflammation. And when there are fluctuating levels of cortisol, symptoms may include decreased metabolism, higher blood pressure, depression, chronic fatigue and insomnia, migraines, acid reflux, decreased immunity, tunnel vision, arthritis, and hunger cravings. When you have increased levels of cortisol, it may exacerbate hypothyroid symptoms like decreasing metabolism, making it harder to lose weight. And cortisol will also decrease thyroid hormone production. So it will decrease the production of TSH, and which in turn has an effect of lowering the production of T4. Cortisol can also affect the conversion of T4 to T3. T3 is the active hormone, the hormone that controls our metabolism and our energy, helps us to grow our hair. There are receptors on every cell for T3 in the body. And higher cortisol levels can also increase reverse T3, which we do not want to happen. Cortisol will also affect blood sugar, which will indirectly affect hypothyroidism. So too much or too little of cortisol can lead to a hypo or hyperglycemia or both, and that can also make hypothyroidism worse. And adrenal stress will have adverse effects on thyroid function. In order for the thyroid hormones to be able to do their job of getting into the cell receptor has to be activated. And if it's not activated, then there will be no absorption of thyroid hormones, no matter what the level of production is. For example, someone who has Hashimoto's, who has been taking thyroid replacement hormones, but will still suffer from low level of thyroid hormone, regardless of the amount of the dose that they take or the medication. And in those patients, it is the thyroid receptor on the cell that is depressed and not allowing the T3 to be able to get into the cell, and that can occur because of inflammation. And it's really important to understand that cortisol can be related to that. So if you have any questions, please feel free to send me a private message or just comment in the comment section below. And if you would like to set up a time to talk to me, I have a limited amount of free 30-minute consultations available to anyone who would like to get more information about how I work with patients. Thank you so much for watching.